Hello, everyone. My name is Kasia LION, and I have a great pleasure to present our international project today. I want to speak about the international perspective of residential aged care experiences based on learnings from family carers during COVID-19. We conducted our study across Australia, Italy, and the UK. We looked into the restrictions and changes implemented during the COVID-19 pandemic across those three countries. And we also looked into how those changes impacted people with dementia in our residential aged care facilities and also their families across those three countries. We spoke with 58 informal carers across our three countries. The interviews were conducted over the phone, over the Zoom or Teams, depending on the preference of our participants. In each of the countries, we conducted thematic analysis separately. Then we gathered together with representatives of our research teams from Italy, UK, and Australia to look into a cross-country comparison, to look for similarities and differences across residential aged care facilities experiences during the pandemic. Today, I want to look into those four themes we developed, but I will focus during this presentation on the similarities across our three countries. Implemented adaptations in residential aged care facilities in response to the COVID pandemic was the first theme. In all of our countries, we faced nationwide lockdowns, and in response, there were no visits in residential aged care facilities. Those brought a major impact both on families and on people with dementia who were not able to see or speak or touch their family members for a long time, depending on the country. It was longer or shorter period. But what we noticed that later in 2020, in majority of our countries and majority of the districts, there were possible some safe visits. Residential aged care facilities implemented some strict and safe guidelines, which provided opportunity to visit, but also created some difficulties. For example, for people with dementia to be able to social distance and not touch their family members, especially after a long time when they didn't see each other. The second theme, which was very important across all our three countries, was staying in touch, both with what's happening in residential aged care facilities, but also staying in touch with people with dementia during the lockdowns. Family carers noted that it was very important for them to be updated of what was happening in the facility, what was happening with the residents. And they suggested that more frequent emails or even short text messages would be very helpful for them. Also, staying in touch with people with dementia was very challenging. Facilities responded trying to implement using technology, WhatsApp, Teams. What we noticed across the countries, however, it was challenging when there was a staff member willing to help people with dementia. It was possible to stay in touch when they were getting some tips. For example, look, there is your mom on the screen, you can talk to her. And it was really helpful. How residents responded to pandemic? They were confused and it was difficult to communicate with them over the technology. Family members noticed cognitive deficits and physical inabilities to progress across those people. But they noticed that some of those changes were reversing after reinstalling the visits. Importantly, family carers also experienced a lot of emotional burden, and they tried to cope as much as possible. Some of them did it in a very positive way, but unfortunately, many of them said that they were uptaking drinking or eating junk food. We can see that both people with dementia and carers face challenging consequences of the restrictions, and we still need to implement safe solutions for them to be able to facilitate more frequent in-person contact. I want to acknowledge my team at the end, and I also leave my contact details for you to get in touch. Thank you.